everyone, this is an informative video coming from the Lance Hospital doctors. To explain the topics about the following case, here are doctors Luciana Contreras, Ana Cristina Bañuelos, and me, Nina Monge. The case we're going to talk about is James, a 21-year-old man who has not been living a healthy lifestyle, has bad habits, and his blood pressure qualified him as pre-hypertensive, which means he has an increased risk of developing hypertension in the future.
In Jim's case, we can see several risk factors for developing cardiovascular disorders. For example, smoking. When you smoke, your heart as a result has to pump faster, and it affects the blood capacity of carrying oxygen. He doesn't exercise or do any kind of physical activities, and it's important to know that having regular exercise helps to prevent this type of diseases, and it also reduces hypertension. One very important risk factor that he has is the extra weight. Why is this a very big risk factor? It's because with more fat tissue, it causes hypertension because the heart needs to send extra blood under pressure. He also drinks alcohol during weekends, and this makes an increase in the blood pressure, and that may also cause a stroke, and it weakens your heart. And finally, having an unhealthy diet, as we saw with him, he eats a lot of fast food, and eating fast food affects, since they increase the probability of having a disease such as obesity or diabetes and many other more, due to the saturated fats, and also the amount of salt that is present in this kind of food increases blood pressure. So he definitely has a lot of things to work in to help prevent more cardiovascular diseases or any complication.
Now we're going to talk about the cardiovascular system. The cardiovascular system consists of three: the heart, the blood, and the blood vessels. The heart pumps up the blood through the blood vessels to deliver oxygen and nutrients to your whole body. The cardiovascular system consists of three types of blood vessels: veins, the capillaries, and the arteries. Here we can see how they're put in action. Well, the blue ones are the veins, carry oxygen-poor blood from the body up to the lungs. And the red ones are the arteries that carry oxygen-rich blood from the lungs up to the body. But how is this all related to blood pressure, you may ask? Well, the blood that is pumped up to your arteries exerts a pressure within its walls, usually known as blood pressure. Your blood pressure measurements takes into account how much blood is passing through your blood vessels and how much resistance it encounters. The narrow arteries increase the resistance. Thus, the narrower your arteries are, the higher your blood pressure will be.
The respiratory system consists of two parts: the upper respiratory, which includes the nose and the pharynx, and the lower respiratory system that includes the larynx, the trachea, the bronchi, and the lungs. The process of respiration is divided in three steps: the pulmonary ventilation, the external respiration, and the internal respiration. First, the pulmonary ventilation is where we inhale and exhale air, or the process of breathing. The inspiration takes the air into the lungs. In this phase, the diaphragm contracts, giving as a result the thoracic cavity to increase of volume. In the expiration, the air comes out of the lungs. The diaphragm relaxes as well as the elastic recoil. The second step is the external respiration. This process involves more deeply into the lungs. Here is where the change of gases between the air in the alveolus and the blood capillaries occur. The oxygen from the alveolus goes into the blood. The carbon dioxide will go in opposite direction of the oxygen. Carbon dioxide will move from the blood into the alveolus in order to be exhaled. Then in the internal respiration is where the exchange of gas between the blood from the capillaries to the surrounding tissues occur. In this process, the oxygen from the blood will move to the tissue or body cells. Then the carbon dioxide will travel the opposite way. CO2 will leave the tissue and goes to the blood. Let's talk a little bit more about Jim's case. He said that he has been smoking for the past 2 years. Smoking is a bad habit that can lead to severe consequences in body organs. People who smoke are more likely to develop heart disease, stroke, and lung cancer. The cardiovascular system is related with the respiratory system. This is because, as mentioned, in the respirator the blood is being oxygenated and the heart is the one who pumps the blood throughout the body. To be more specific, the blood comes to the right atrium. Then it passes through the right ventricles, and from there the blood is passed to the pulmonary trunk. Now in the pulmonary trunk is divided into right and left pulmonary arteries. The areoles take the blood to the pulmonary capillaries, where the gas of exchanges occurs. Then the blood passes through the pulmonary venous and then to the left atrium. Like that, it's kind of like a circuit between the heart and the lungs in order to oxygenate the blood and being pumped throughout the body.
Now we're going to be seeing 4 organs of the urinary system and their functions. As you can see, here is a visual representation of how that looks. Here we have the kidneys, which are the most important organs of the urinary system, and their main function is the production of urine, the filtration of blood, the control of body's fluids, etc. Now, if we move over, we get the ureters. In the ureters, with peristalsis move, they move urine into the bladder. When we move into the bladder works as a storage of urine or a reservoir, and it helps to provide continence. And if we move to the urethra expels the urine from the bladder up to the outside of the body. Now we're going to talk about a very interesting topic, the urinary system. But first of all, we're going to see the functions of it. Right now I'm showing you here a picture of how the urinary system looks like so that you can have a better idea. The urinary system helps you to keep balance in your body by removing waste. As the name says it, the main function is to produce urine and to conduct it outside of your body, and it also helps you to filter blood. Now we're going to see a very important part of the urinary system. Here you can see a little image so that you can have a visual representation of what we're talking about. So first of all, a nephron is the basic structure unit in the kidney. Their function is to filter waste and toxins, return molecules needed to the blood, and separate ions, water, and small molecules from the blood. Now we're going to see how the blood gets to flow through the kidney. It does this through the renal artery that is divided into the interlobal, arcuate, interlobal, and segmental arteries. In the case of the afferent arterioles, they become glomerular capillaries when they enter the nephron. Peritubal capillaries that are surrounding the nephron comes from the efferent arterioles. These capillaries become to what is known as interlobular, arcuate, and vasa recta veins, and they are eliminated through the renal vein. Now we're going to see the process of urine formation that is composed of 3 very simple steps. Here you can see a visual representation of how this process looks like. Starting with the glomerular filtration, this happens when blood enters the afferent arteriole and flows into the glomerulus. In this process, water and other small molecules move from the glomerulus towards the glomerular capsule. In the case of blood cells and other large molecules, they are not able to pass through the capillary walls, and instead they will exit through the efferent arteriole. Moving on to the second step, the tubular reabsorption. This occurs when ions and molecules are either passively or actively reabsorbed from the nephron up into the peritubal capillaries. And finally, moving up to the last step is the tubular secretion. Substances are removed from the blood into the peritubal capillaries, this with the use of active transport. Some substances that are removed are potassium, creatine, hydrogen ions, and drugs. The final product is obviously urine, which is a collection of substances that have experienced tubular secretion and glomerular filtration, but that have not been reabsorbed.
Now, let's talk a little bit more about Jim's case. According to his body mass index, his levels are 27.7. This means that he is in overweight. In order to change his numbers to a better status, we need to do some changes to his diet. Here are some dietary recommendations. Choose a diet that is based on low fat, low saturated fat, and low cholesterol. Your plate should be balanced. The recommendations are to 50 to 60% of carbohydrates, 30% or less of saturated fat, of not saturated fats, and 12 to 13% of proteins. Instead of drinking soda or sugar products, replace it with water. Use sugar supplements or sugar in moderation as well as salt and sodium. Exercise at least 20 minutes a day to maintain a healthy lifestyle. Make sure to consume multivitamins and minerals from your diet.
Hi, this is Dr. Cristina. Thank you so much for watching Land Hospital.